Hi, in today's lesson we're going to be covering diabetes and the effect of lifestyle choices on health. So firstly we're going to look at, we're going to do a graph plotting exercise to show the difference in blood glucose levels between diabetic and non-diabetic. You'll learn that type 1 diabetes, that's the one you're born with, because for some reason not really understood yet, but your immune cells attack the pancreas and destroy the cells that produce insulin. Type 2 diabetes, which we're seeing more and more of, is much more of a lifestyle disease caused by a poor diet. And then you're going to go on generally to look at different lifestyle linked diseases. So like type 2 is lifestyle linked, whereas type 1 is a genetic disease. So diseases, obviously, such as things like skin cancer, lung cancer, etc. So let's have a look at what you're focusing on in the iBook today. So we'll be covering this bit on diabetes and this bit on lifestyle choices and health. So the first thing I want you to do is a graph plotting exercise. So you've got some data here where you have as the independent variable the time after drinking a can of fruit juice, and you have two people's blood glucose levels, Samita and Jonathan. And you'll plot a graph and it will look something like this. And what I want you to do is to label the, if you like, the different events on here that cause the blood glucose levels to change. So obviously start off with a can of fruit juice drunk here, and for both of them the blood glucose level goes up. In this patient, the pancreas does release the insulin and causes it to be stored in the liver as glycogen, which brings it back down to normal. However, in this patient here, without the insulin, the blood glucose level has gone dangerously high. In fact, this is the level defined as dangerously high, so you draw a dotted line across there. And finally, what causes the level to drop eventually is when the kidneys actually start excreting it in the urine. So normally in this lesson I would have had two beakers of what I would call urine, one of which containing glucose and the other one not, and I would have drunk these or sipped these urine, and one would have tasted sweet, and that's actually how doctors used to diagnose diabetes. One of the proper names for diabetes is diabetes mellitus, which in melles is Latin for honey, so that's where the sweetness comes from. Anyway, so and it's also a chance to revise your food tests, because what you, instead of tasting urine nowadays, the blood tests that diabetics have are based around the Benedict's test, which we used to test for glucose back in year 10. So you'll be able to cover that as well. Right, so then there's some tasks in the iBook, which are these here. So the treatment, so type 1, they have to have insulin injections after a meal, after testing their blood glucose level and seeing how much insulin they need. And type 2 through changes to their lifestyle. So go through, is it genetic, is it lifestyle, how is it treated there? Describe the risk factors for type 2, that should be straightforward. And again, this is the bit I was just talking about in terms of using Benedict's to test for the presence of glucose in the urine. And remember, when you're describing a test, you must say the colour change. So the colour it started and what colour it changed to. So Benedict's is a blue solution. So that's that. Okay, next is onto the lifestyle choices and health section. So vitamin deficiency diseases. If you do look up what scurvy symptoms of, this will certainly encourage you to have your 5 a day. Mineral deficiency, iron, anemia, lack of iron, alcohol, short and long-term effects, bowel cancer we've got here, UV radiation, tanning salons, etc. And this is really just revising what you did in year 10 about the effects of smoking. Okay, so then we will go on from that and move on to drugs next lesson. Right, next, what do I want you to do? Oh yeah, so lifestyle choices and health. This time there's another Neopod and lifestyle choices and health, so you have to match up the cards to show that. I won't keep that one too long. And once you've done that, you should be able to make a table that links the disease to the risk factor. Okay, and don't forget to upload any photos or submit any digital resources so that I can give you some feedback.